Hi, it's Dr. Elisha Van Dusen at New Hope Chiropractic. And a neck injury, like a pulled muscle or a knot in the muscle, is something that we've really all experienced at some point or another in our lives. These little aches and pains usually go away on their own or with a little bit of massage from a loved one, some stretching, but sometimes the neck injury is more substantial, like a whiplash or a sports injury. And in these cases, the ligaments can be injured and the nerves can be inflamed as well. And the long-term course for neck pain is typically not good. Patients can continue to suffer for years and years after a neck injury, as a matter of fact. One study looked at the outcomes after 5 years and found that about 50% of patients continue to have pain and disability. When the ligaments and muscles of the cervical spine, that's your neck, are injured, you can have guarded movements and not use certain muscles to refrain from further injury. This can lead to muscle weakness over time. And as the neck muscles go, so goes the rest of the spine, or at least that's what recent research shows. In one study, researchers followed neck pain patients for 2 years and found that those with neck pain tended to get trunk muscle dysfunction and eventually low back pain as well. Following traumatic injuries to the neck, it's important to have a proper exam, which sometimes includes x-rays as well. Getting an accurate diagnosis then is the first step to getting you the treatment that you need. One study has shown that early intervention, that's within 4 days, in the case of a whiplash injury, for example, results in people experiencing more relief than if treatment is delayed by 14 days. They get better faster. And as I've discussed, many patients become chronic and have long-term pain after neck injuries. Others will develop secondary low back pain 2 years down the road. And because of these long-term effects, it's important to treat neck injuries in a serious manner. Ice usually won't be sufficient. These mechanical types of problems are also not correctable through medications and neck collars, which often weaken the muscles. So specific chiropractic care following sprains to the neck may move the joints into better alignment and ease tension of the tissues. Mobility disorders like limited range of motion, they can also be improved with specific chiropractic adjustments. As the joints begin to move more normally, exercise can be added to improve strength and function. And by treating neck problems appropriately and early on, you'll be afforded the best chance for long-term success. So if you or anybody you know has a neck issue, especially one that's become chronic, or even if it's just occurred recently, I encourage you to call our office at 714-556-6966 and get it checked as soon as possible. Have a great day.